their own languages, starting to really think about how can we solve
Giving up, there's so many different kinds of scientists, again, all focused on a singular, very practical issue, which is to reduce preterm birth. And I think that's something that is going to be a landmark approach to complex human problems like preterm birth.
It takes the creativity and ideation that comes from people with different disciplines coming together to ask yet unasked questions.
From different countries with different disciplinary background working together and telling us it is important to work together. The second part is the actual implementation of Transdisciplinary Approach project, which is preventing preterm premature delivery. So the prevalence of premature delivery is very high in the US among African Americans. So they wanted to provide a lasting solution for this problem. It's not because they are poor, it's not because they are uneducated. Even among educated women, preterm delivery is very common in the US. So they wanted to know why is this happening. So they came together, scientists came together to develop an intervention to address this problem, which was effective. As you have seen, there is engineers, epidemiologists, public health professionals, physicians, different types of physicians, pediatricians, internists, neurologists, and so on. They came together to develop this intervention, which is transdisciplinary. So, what is transdisciplinary? Here is the definition. Transdisciplinary focus on addressing problems or issues that cut across the boundaries of two or more disciplines. It is based on developing collaborative framework beyond a disciplinary perspective. This is the basic thing. This is what differentiates this type of collaboration from the two types of collaboration you have seen previously. So examples: healthcare, public health, social workers, organizations, institutions, and the community work collaboratively to improve access to healthcare among the underserved community. This is just as an example. So, as you see from this, they are interconnected everywhere. They are connected. This shows that they exchange, they have common framework, common plan. They have the same objective. So to address these problems, answer questions, and provide solutions, they sit around a round table, they meet, they get together, and they develop a common framework. It's no more the framework that you are bringing from your department. It is a new framework. I will give you an example. For example, the same example I used for the wedding. For the wedding, you want to make a dorowat. So one person will bring the berbere, the other will bring the kibe, the other will bring the chicken, the other will bring different things, the spices and so on and so forth. What would you make? A dish, one dish, dorowat. That is transdisciplinary. Does it make sense? So it is no more the chicken, it's no more the spices, it's no more the berbere, but you are calling it a dorowat, which is delicious, which is a new type from the doro, fried chicken, from other types of what? It is just a dorowat that you brought the resources together and produced a new type of dish. That is transdisciplinary. So you sit together, you have a common plan, then you will execute that under that plan you will execute an intervention based on that plan. So we will see more about transdisciplinary collaboration. Here, transdisciplinary collaboration is an integrative process whereby scholars and practitioners from both academic disciplines and non-academic fields work jointly to develop and use common conceptual framework and methodological approaches that synthesize and extend discipline-specific perspectives, theories, methods, and translational strategies to yield innovative solutions to a particular scientific and societal problem. Three-term verbs. Infectious disease in the community. Yes, it is important to address it, to treat the disease, but there are other issues also associated with the spread of the disease, how the disease started, who is at risk, why that community is at risk. There are different issues. Yes, treatment is needed, but there are things to be addressed as equal importance with the treatment. So different disciplines should come together to provide a lasting solution. This is the importance of transdisciplinary intervention, collaboration, transdisciplinary thinking outside the box. Who will help me to address this problem? I can do this. How do I reach out to other disciplines so that they can come and work together and promote what I am doing? Provide a lasting solution to the problem. So, the origin is clear. It started in France and the United States. The concept of transdisciplinary has evolved over time. Switzerland was the first country to apply this approach in research in the 1990s. Today, transdisciplinary is applied everywhere. I will give you an example. There is a university where I am from, in St. Louis, Washington University in St. Louis. They, under the global health outreach, students from engineering department, from medicine and public health developed an intervention in Mekelle. Mekelle, the blind people who can't, visual impairment, they developed a water source, a very beautiful water source. These are transdisciplinary team who provided a water source for a school in Mekelle. So, most of you are students in different fields. So the reason why this is important to you is, even from during your training, a curriculum where you can work together with colleagues or students from different disciplines might be needed. A project that you can work with a medical student, a public health, a social worker, an engineering student,